Welcome back to the Take Two Aesthetics podcast.
With me, Danielle.
And me, Rosey.
Oh, hey.
And we'll start, as we always do, a catch up on the week.
So I'm going to ask you because I am tired. I've had a good night's sleep. So how are you, Rosie? How's your week been?
It's been really good because I've been banned from clinic, not officially, unofficially by the team. I don't like to call them my staff, but by the team. Yeah. I've been banned from clinic.
That's lovely though.
Well, they're virtually on the point of putting a photo fit up on the door. And if they could wire it up to an alarm, if I'm
not let this lady in.
tag the owner of the clinic if she's within a certain proximity of the clinic. Wow. An alarm will go off. No, so I've had 2 days. I did go in and do some emails, but I hid myself away. So, but also we've got the hosted aesthetics coming up in June, which is 3 days away from the business.
Yeah,
but looking at devices, so different treatments that we can bring into clinic, that we can talk to the manufacturers of those devices. So 3 days, it's like speed dating.
Yeah.
But I've got to get frocks.
Oh,
I've got frocks.
Exciting there. It's Malta, isn't it? In Malta. I've never been Malta.
No, because you put your foot in it and you didn't get through to it.
I didn't. I got a no.
You were honest.
I got a no. So now I've got to experience hosted through Rosey, through everyone's social media. That's going because I got an but it's fine. It's fine.
It is fine.
Sometimes you've got to accept these things in life.
It
wasn't meant to be.
No, it's just all it is like a business opportunity, isn't it? It's not kudos. But I've got to get a frock. And being a woman of a certain age and many moons, it's really hard to get a frock where you don't want to get your boobs out, because basically I'd be wearing a skirt to get my boobs out.
Have you got a vision of what kind of frocks you want?
Well, I want something. You know, when you go into certain shops and you see ladies a lot older than myself looking at certain things, and you think, well, I ain't looking at that. And then you look at other stuff and you think, like I said, you know, things aren't where they used to be. So you can't wear certain things.
Who are you now?
Exactly. I'm not ready to go down the pleated skirt route.
Yeah.
So trying to find something is really hard. But Karen Millen online, if anyone's of my age, look at Karen Millen.
Yeah.
And I've got 2 dresses from there that were reduced, win-win. And I'm really looking forward to wearing those. So yeah, but it was difficult to find.
Yeah.
Really hard, because I don't want to be frumpy. I'm not frumpy.
But I think the thing is, we'll go through these stages in life. This isn't even part of what we plan on talking about.
No, it's not.
But the last time I went on holiday, I'd obviously had Ace, my 3rd child. And I still, in my head, I'm really young. And then I was like, I don't know what I wanted to wear. I couldn't find myself. So I was like holiday shopping, but I'm not a dress person. I'm like a co-ord kind of person.
Anything.
But that thing ain't in anymore. And I was like, who am I? I don't know what my vibe is. I don't know what I want to wear. And it was the first time I've ever struggled and thought, I don't know.
I know. It's really hard. I mean, I'm 26.
And now but now it's sunshine in Rosey. These trotters aren't ready to come out yet. They've not been done. Amy can't fit me in for my nails.
It's disaster.
And my legs are like pasty, white, scabby milk bottles because I had some cryopen. And it's taking ages to heal.
I'll go at your nails for you.
White. That means I've got to shave his legs. I'm not ready to come out of hiding yet.
It's a lot for women to get ready for things, isn't it?
Yeah.
You have to book it all in from top to toe.
And makeup, I'm shocking at doing makeup, so I don't wear makeup other than mascara, my Abargi SPF. And today I've got lip tint on because I'm meant to be having my lips blushed. So I'm trying to get used to it.
Though. So what about your week? Less about me.
Yeah.
Well, less about you. Let's get back to me.
Still trying to get this training centre ready, and it's just not going it's not organised because I'm not organised. So that's all you need to know.
But we always get there in the end.
Incredibly busy week.
Yeah.
Incredibly busy times at work, which I'm lucky. Well, I'm not lucky because again we work hard for it.
We work very hard.
Yeah, I appreciate everyone who comes to clinic. So thank you. I did a full consultation for someone this morning in the car park while I was waiting for Rosey,
but not face to face,
randomly.
Still confidential.
She was just talking about skin, And anyway, now she's booked in one of my breaks because we couldn't get her until June. But yeah,
I just want to help people.
I love it.
We just want to help people.
So yeah.
So
there we go.
What our conversation was, we find it hard to nail this down, didn't we? We got so many things that we want to talk about, which may be. Oh, so that wasn't me parping. I'm sitting on my phone. It just buzzed.
If the mic came from a gingina.
We're talking, and I haven't got my genus showing, which I never knew that term either.
I said a gingina. A genus, not a genus.
Yeah, don't go.
It's just where your genes come up and look like
it is. It is. So I
don't know if we need to beat. We don't need to beat.
Anyway, so we're going to talk about what the media, what was termed in the media as pillow face.
Yeah.
And where fillers sit.
Yeah.
Now, and everything that's happened with fillers, basically.
Stigma surrounding them. Yes. They've got such a bad name.
Yes.
Yet they have such an important place in the aesthetic industry because when they're used correctly, they can be life-changing and have significant positive impacts. Nothing's ever going to replace volume. Like a filler's going to replace volume. But it's all key to what product you're using. There's
so many factors, aren't there? There's so many factors.
Anatomy.
And, of course,
change, aging, bone, everything. Yeah. So,
so where it's come from, so when I, when I started in the industry, when was that? 1999? Yeah.
Wow.
No, 2002. 2002, sorry. So I'm working out with my son's age. So he's just starting primary school and I'd just gone into do a line softening medication course. Anyway, so there were only 3 fillers on the market at that time. Worldwide, there were 3 fillers. And all we did was we just treated nose to mouth lines, marionettes and lips. That was it. That was the level of the knowledge of the aging process at that time and where we would treat.
I love listening to you.
So, because it's crap.
Wow. No, it's changed so much.
But which has gone first? That's the interesting thing. Because do we go that way? Do we go that way? Because has has our knowledge increased that then that's meant that different fillers have come to play and been manufactured? Or is it that different fillers have come to the market and then the knowledge? I think it's the knowledge that we've got now that has led to that whole evolution with fillers, that we can actually, everywhere's a risk. We know that. Everywhere we inject, you can't, other than not do the treatment, you can't avoid that. There's different levels of risk.
Yeah.
But we now have fillers. So there's a massive surge in fillers. I'd love to say the figures, but I could never retain it.
Quite a huge but
exponential growth worldwide. Well. But there was a dangerous amount. Excuse me. And then we get to then we get to the place now, probably a couple of years ago, where people were starting to look very weird. So very, very, very weird in every area of the face, overtreated, positioned in the wrong place, as you said, wrong depth, because we know the different depths we're working with.
Pillar face.
And repeated treatment too much, which again you mentioned this morning. Bobby having fillers how often?
I think he said every 3 or 4 weeks, which I'm just going to touch on every 3 or 4 weeks. If I've got a patient who is 60s, 70s, and we're doing a full face rejuvenation, less is more. So I might do 2 syringes, 3 syringes, review them at 4 weeks, add another 1 or 2, review them again and get them to a place where we're like, right, that's enough. They're happy. Result looks natural still. So it's acceptable in some cases, as in for across 2-3 months.
Yep.
But in a younger face, at the time it was in his 20s, in a younger face, when it's on a monthly basis for however many months or years, that's catastrophic. It can be.
That just is mind-blowing from the possible complications, the risk that he's exposing himself to. And it also brings into question, number 1, who's treating him. Number 2, what is the quality of those products? Because actually, if the products that like we're using, they're world leading products approved at the highest level. So if you're using those sort of products, their longevity or how long they're going to be beneficial and to deliver what we want them to deliver, you know, restoring a bit of volume, giving the appearance of lift, then those products are going to perform and sit there for 12 to 15 months, maybe 18 months. Some can be 2 years, but they are top quality fillers in the hands of top quality injectors that are suitably trained, experienced to handle anything unwanted. So why would you need to, that's a psychological need, and that's something that we guard against, because that is not the usual pathway for fillers. So what's happening when we get pillow face? Because we've gone massive, then it's hit the press, along with crazy contoured jaws. It's progressed from the huge lips. It's progressed
Disney
from that.
Prince jaws.
Yeah. So all of that, what has happened to create that?
Do you know what? It's going back to when you said as well. So that much has changed now. So it's gone from injecting to lips, nasal folds, and did you say marionette?
Yeah.
Now we inject everywhere on the face.
Yeah.
But so many people don't move with the times and don't continue training. So they don't learn the correct placement, the correct depth, the rheology of the product, how it reacts in the tissue. New injectors, again, are getting the hands on products that are too hydrophilic, putting them in the wrong place, overfilling, not seeing. It is art and science.
What's hydrophilic mean?
Attracting water, gathering it.
Yeah.
Filler loves water. It gathers 1,000%. Is it? It's molecular weight in water. So tear trough. The amount we were dissolving a few years back, so many tear troughs where patients had been to places and they were using really hydrophilic filler underneath the eye in the tear trough area, which were just creating mounds of puffiness, water retention. Remember about lymphatic drainage, Tyndall effect because it was placed wrong. But yeah, people, so there were two things. People aren't moving with the industry, so they're not increasing the knowledge, they're not upping the skills.
Totally agree.
And then number two, I want to ask you, what is a dermal filler, Rosey?
Ooh.
I'll give you that question.
Thank you.
With all your knowledge, because you're a fountain of it and I love it.
So dermal filler is a good question, because to name a prescription medication that's used, which we'll call toxin, so people can work that name out, there are other brands available, that's injected into muscle, targeted muscle areas where the muscles are causing the lines that we don't like. So we're not directly treating the lines, we're causing the problem, which is the muscles. So that is where that prescription medication in a patient's name sits to relax those muscles. Then we get an improvement in the lines more or less instantly, and that will build up the more you have the treatment. Dermal fillers, which interestingly patients coming into clinic sometimes mix up those two. So dermal fillers are very different. Dermal fillers are, majority are made from hyaluronic acid at what we call different concentrations, different percentages, and they are what we call cross-linked. So if you think of like in a ball pit, you know, all those different coloured balls in a child's ball pit, those are like molecules of hyaluronic acid, and the walls around that ball pit hold those balls together until somebody comes and jumps into them and they will separate a bit.
I love this.
So those different balls, the different percentages, so if there's a hyaluronic acid that we call is 18% hyaluronic acid, then they are held together in shape, and when they are injected into the desired depth, so we talk about different depths, it can be to bone, it can be into the fat, it can be above the fat, it can be slightly above the muscle. If I go deeper than that, it will restore or replace lost volume. So if we lose weight, if we lose a lot of fat on the face, we can get the body we want, but we do come of an age where if we lose too much on the face, then we can look very tired, it can look negative, we don't like it. So fillers sit beautifully with that in restoring contouring, supporting, loss volume,
Mm-hmm.
and they will, what the language we use is indirectly cause lift. You can't say a filler definitely lifts
because
but
that's surgery.
Exactly. It will have a subtle effect of giving that appearance of lift. So the language is important.
Yeah.
So any practitioner that says we can lift, they can't, unless it's surgery. They can't. It has to be, it gives the appearance.
And they can give
lift.
support.
And it supports
and
tissue.
Slight structure.
Exactly. So for patients that may be coming up 25, 30, then that's a different approach for many of those. It's called beautification.
Yep.
So the filler can be used at whatever strength we choose for that area of the face, what we're wanting it to do. So often for that age, it's a little bit more projection of the cheek. Then that filler sits beautifully and it will do that. When we get to maybe perimenopause, could be 35, could be 40, could be 45, but certainly 45 and upwards, then what's starting to happen is things are starting to shift a little and more support is wanted. And the filler can be used, and this is the key, in target areas with somebody who is very, very experienced at what they've been trained to do, what their knowledge is, but applying that with that product to the person that's sitting in front of them. So this becomes a bit like a recipe, if you like. So you can't actually go and put 10 people, male or female, in a line and do exactly the same for all of them.
So everyone's completely different.
Everyone's completely different. And that is the skill. And I think that's where pillow face has also come from.
Yeah. It's everyone feeling the same.
Exactly.
Every single
and not
person.
saying no, not having the confidence to say no as a practitioner, because maybe they're monetary driven. You know, they want to sell those treatments.
It can be, it might be more of an intimidating patient who's come in and said, I want this.
Yes.
And the practitioner, if they knew, might actually be scared to say no.
Yeah.
It takes a lot of courage to learn to say no. I keep knocking this microphone.
That's all right. They'll listen to me.
I'm not being that loud today. I'm like intrigued. I love listening to you. So, and I've got another question for you then. So what differs I don't know how to word this, different companies. So there's so many different companies with different filler brands. What makes, I don't want to mention any brands actually, but what makes two brands different from each other, for instance?
What makes them different? Those that...
Can I just point these questions? I have not asked Rosey this question
from my face.
So I've literally...
I am going to kill you.
Jumped on her like, bam, I'm going to get you. Come on, I love it. I love listening to you.
I think essentially what makes them different is obviously their research, for one thing.
So the studies.
So the studies that they have behind their products. That is massive. But also for me, the regulation of those products. So there is a product that, you know, when patients come to clinic and they will say, well, your prices are very different to where I've been before. So I say, well, what was it that you had before? Number one, the patient won't know the name of the product they've had before, which is concerning to me.
Yeah.
And also they'll say, well, it was to do my cheeks. It was £80 and I had 2 syringes.
Don't get me started.
You don't need to go any further into that conversation for me to tell me that that's not a regulated product that's being used. I can't get 1 syringe for that price of the level of filler I'm using, but I know that I have the support, which is a big thing. I have the support, should I need it, of that pharmaceutical company behind me. So they will have experts that, should I need it, I never have, that I can go to them and say, what is going on here? I need help. You need to look at this because I'm reporting it to you. So they will take the batch number if there's an issue with a product. They will take every detail of my notes as to when it's injected, how much I've used, exactly where I've injected it, and they will want a full batch number, a specific number and date of production that's given to every single box of medication, everything we use. And then they will research it. They will look into that and see if there's been other reports. So that safety net is huge. And that is also what you're paying for. You're not just paying for that £80 to do the cheeks and was 2 syringes, because that is not a fully licensed product, and that is not in the hands of a medical professional, of a nurse, doctor, dentist, prescribing pharmacist. It's not. So that's the fact of it. You and you're that lovely thing. If it's too good to be true,
it's too good to be true.
It's too good to be true.
And I think the thing, I know we've briefly said this in an episode before, but as a practitioner, please go direct to the companies and see what pharmacies they supply, because if you're not getting that product from a pharmacy that company supplies,
where's it coming from?
You don't know if it's imported, and you're not going to have that support what Rosie's just mentioned. And they're not going to have no log of how much you're purchasing to prove that it is a legit product. And I'm just going to touch on this because I'm going to go off subject, but I was teaching someone who is new to injectables, medical background, and I mentioned this to him. I said, you need to be getting it might have been, I'm not even mentioning what products, it's not very good. And I said,
beep it out.
So
was it shit?
I'm not even doing it, because you know what, I'd get beeped out too much. It's crap.
Defined by shit.
And I was like, right, so I got trained in that product initially. Can you see how uncomfortable I'm like, oh, I'm trying to behave. I got trained in that product.
What colour box was it? What colour box?
White.
Oh.
It sounds like constipation.
Okay, yeah. Yes,
it didn't sound like constipation.
Yeah. Yes, I know which one you mean. Yeah.
And I was like, right, you need, I don't even know how to start, but start and like look around for good world renowned brands and blah blah blah, and you need to get in touch with the reps and find out why. But I will like, the reason why is so that if you have any complications, you've got a supportive network around you. They can literally help you. And the reply was that the friends do Aztec, so they've got support if they need it. And I was like, oh my Lord,
what could possibly go wrong?
And I'm touching on something else here. But fair enough, there's a big divide. You're fanning around with your plant. There's a big divide between therapists and medics, right? Yeah. But there is also some medics who are acting like what I've just said. And there's some therapists who might actually take it really seriously, and they do their absolute best. Yeah. So I'm not even getting into that.
That's not going that one.
We're not going into that.
But you're right.
But yeah, I would just like, how can you just be so ignorant to not even like care about having this supportive network of doctors, pharmacists, nurses around you who represent the company. If you've got any complications, that's not having the best for your patients.
No. And I think we've got to give from our side a huge shout out to the product specialists.
Thank you, guys.
Because they are, thank you, because they are, they are here to support us as well. Yeah. They're a good channel back to the global pharmacies. They know exactly where to direct things to. And also with, innovations and new, sort of new rumbles in aesthetics. Yeah. They are great. They are absolutely, outstanding.
With companies.
I do just love it very much. And they are another level of professional. They
it gives
really
it a nice little balance as well, like work balance, injecting every day, and
they're
then
so sciencey, aren't they? They're so what they know about their products is and competitor products.
Nancy at Allergan,
Nancy's a dream,
incredible.
Absolute dream. So so that's how
we're not naming no names, but Nancy at
Allergan,
insane.
I'm gonna have to tag her in here.
I want to as well touch on the stigma associated with filler. As in, I know we've briefly gone on to pillar face, and like I've said, filler is nothing's going to replace filler volume like filler does. But I get so many patients coming into clinic who say, I want this, but I don't want filler. I really don't want filler, but they will have toxin. And then I have to say to them, and this happens where, fair enough, we don't want to ever be putting filler in and dissolving it because we don't like how it looks. But any side effects, anything like that, we can deal with it. We can reverse filler.
Everything we need.
Toxin is a drug. So I feel comfortable using both. I use more toxin than probably anything.
Yeah.
But it sits so comfortably with people who've never had a treatment yet. It's a drug. And if you get an eyelid ptosis,
yes,
or something like that, and you're looking like this, we've got to wait that out.
I have a Tiny Tears doll that was like that.
Oh, I did.
And then I saw it on a horror film. There was a horror film where there was one doll sitting in the room with an eye like that.
Oh, God.
She has no wrinkles.
My friend had one called Birmingham.
Anyway.
My teddy was called Black
Bring it back.
Yeah.
Bring it back.
Bring it back to me.
I don't get that either. It's a prescription medication. People will embrace that and have that repeatedly, and we know that long term there are no ill effects from it. It's been around a long time, particularly one brand that is is named as the treatment.
What gets thrown around willy-nilly.
Yeah, that is abused slightly as well now. But with the fillers, they had a huge surge, then they slumped because of the pillar face.
Now we're going.
And now they're starting to come back up, which I absolutely, celebrate.
Yeah.
Because we know we're working at different depths, don't we? There's 5 layers.
Celebrate.
So, and they have their layer.
Yeah.
They have their groove, they have their lane where they sit, and there is nothing that is going to challenge them from that.
And I think so. Filler is a hyaluronic acid. His body is full of hyaluronic acid.
I didn't cover that. It's a naturally occurring.
It's a naturally
sugar chain.
There we go, which metabolizes.
Yeah.
So filler is hyaluronic acid, and different companies cross-link it slightly different.
Yeah. That's where they join it together.
I'll just touch on this. Most dermal fillers are cross-linked with a product called BDDE.
Yeah.
But now there are also biostimulation fillers, which basically give you an instant volume, and then results increase over time, usually around 3 months.
Yeah.
Which is improving the skin quality.
This is fantastic, isn't it?
Collagen,
absolutely fantastic. And we both love one called Nuvia as well, don't we?
But stimulate, guys.
Yes,
stimulate. Let's stimulate that collagen.
But why would you not? If you are going to, desire and want something injected into your face, which is amazing, will come down to the skill of the injector as well.
These have got to be in the hands of skilled injectors.
They have got to be in the hands of skilled injectors, and we'll come to that. And come to that in a minute, guys. Why would you not want, if you're taking that opportunity, do a 2-in-1? So why would you not want something to stimulate as well, to boost your collagen production? Because everything, we like a bit of stimulation. So everything is all sitting in that mix, isn't it? So you're getting multiple benefits from it, and it's just absolutely the way to go. We'll look on another podcast about skin boosters and skin stimulators that way. So we'll look at that in a different and a different episode. But you would want at that point the very best dual, triple action of something that's going in there.
And you can still layer them. You can use these biostimulators in different layers, different anatomical areas of the face to give a nice natural look, really. But biostimulators in the field are becoming increasingly popular, and there's quite a lot on market, so look out for them. So Stimulate, what we've just mentioned, has got calcium hydroxyapatite in, which
with the hyaluronic acid.
We know Harmonica has.
Harmonica's wonderful.
That's a higher concentration. But then there's other products like Elance, Sculpture. There are different types of biostimulators.
It's a busy market, and that also brings down to the experience of the injector as well, because with all sort of safety, we need to look into the science behind what we're choosing, because that's how we choose to bring something into clinic. It's also the feel of it. It's the result of what of what it actually delivers when we're injecting it, how it feels when it's actually in what we call host tissue, if it's medical, but when it's sitting in the cheeks, how does it feel? Because that's a huge factor as well. So all of those things we need to look at, we must look at, and we do look at to make that judgment and that call. But it is there's a lot of noise about collagen, stimulation,
and I
different
think as a
collagens.
practitioner, look into the research, and you'll find one that you love. But also, like we've just said, we love reps, we love companies, but never just believe what you're told. Always practice, use the products, have your training first, obviously, and then you can never promise results based on what someone else tells you. So use it.
No.
And then you'll get to learn how it integrates well, where you like to use it. And I never say, if I bring a new product in, even if it's a skin product, I'll never believe what anyone tells me. I want to see them results for myself. So I'll never promise a result. Like, I don't even know if I can say this. You might have to beep it if not. There's a new toxin on market, which I've been dipping and diving into. And that apparently lasts longer. But I'll never promise that it lasts 6 months or whatever the company say. I just say, I can't promise that because...
no, you can only go by the data. You can only go by the data,
so it might do, it might not. It might only last 4 months. So just don't believe what you're strictly told.
And what you might choose for one patient might be different for somebody else. And that takes skill. You can't, again, you're not getting one paintbrush and using that same paint for everybody, because, as I say, one product might perform and will perform slightly differently for somebody else. So also, it's that selection.
And back to fillers, it's not only the amount, it's where, like you said, where it's placed. And a really good doctor once taught me and said, it's not about the amount, it's about whose hand it's in and the whereabouts it's placed. If it's placed small amounts in the correct place, you'll get a really natural, nice result.
It's cherry picking. And like you say, if you think about what goes through your mind when you're in a consultation and you're listening to what a patient's saying, you're looking how they're moving the face, you're looking where the loss is, do they look tired, what's causing that, they're looking at the sagging, you're looking at skin quality. All of those things are going through your mind. They go through my mind when I'm having a wee at night as well. I'm thinking
you and your wee is your thinking
my
time,
wee is my wee is my thinking time, particularly at night about 2 o'clock in the morning. But graphic. But all of those things are going through your mind, to be able to map and to cherry pick from all the years of training, all the products that you've used, to actually select that right down and focus it to almost like in the limelight, and you like a spearhead to get that best result. But as the patient says, I don't want anybody to know. I want to see the difference. I don't want anyone to see it.
Do you know what I love though? When someone comes in and they have a consultation and they don't want no one to know. But I love it when they've then had the treatment and you see them a few weeks later for the review. Because I review everyone. And then I'm like, oh, did you tell anyone? And then they've told people because they're so happy that it's undetectable, because their friends might have been so much stigma, and they'll see people and say, oh God, look at them, look at this. So then they're terrified of having it done, so they don't want no one to know. And then when they've actually seen the result is so natural and no one's noticed, they've just gone, oh, you look well.
Moment,
and like, oh,
that moment is better than any other Cadbury's cream egg or Cadbury's chocolate bar, isn't it? As a practitioner, it is just gold, because you've absolutely
hit the nail on the head.
You've hit it on the head. You've got a bullseye with that, and that's what it's about.
And that patient will be a patient for life. And the friends will start to trust you. And it's just, I think it's an amazing relationship when people trust you. With the face as well.
I think sometimes we need to give, we know it's a big thing, but I think sometimes we need to really hold that at the front foremost, because we're concentrating so much on what we're doing. The big thing is that trust that underpins it.
And back to like the last episode, what we filmed, where we're on about positive and that one negative comment. I think with fillers, people straight away focus on the negative. What if I look like this? So they'll come in, I don't want to look like this, I don't want to look like that. But what if it's done right?
Yeah.
And you feel good?
Yeah.
And it's done correctly? And you don't look like a pillar face. You just feel good.
And that's the beautiful thing where the fillers are now. So we are turning, that tide is turned significantly. Don't want it. Well, it was never a thing in our clinics anyway to overdo it, to create that, because it's such skill that we've honed and developed over years of training. And that's another aspect that I digress on. I train, new professionals coming into aesthetics. So again, those groups, doctors, nurses, dentists, and before the end of the training session or just before they're going, they'll say, how do I become a trainer? And I think I just have to take a pause, because I sort of think, well, how long's a piece of string, for one thing? It took me, and I know from a confidence level I'm very different. I was in aesthetics 15 years before I became a trainer, before I was approached by Allergan, which was amazing to be approached. It took me 15 years. Now, somebody coming into aesthetics, it depends how often they're injecting. Are they running it alongside another? If they're still in the NHS or still working somewhere else privately in a different area, then they're not injecting a lot.
No.
If they sink full time into aesthetics, then they're going to get that journey quicker. And I think that's sometimes where it's come from, like you touched on. It's where people are going. If somebody has progressed too quickly and not consolidated what they've learnt as a practitioner at each stage,
the training as well.
Disaster.
There's so many foundation courses where I don't even need to.
No, that's it. Yeah, and how they're approved. And
so I think, just as a practitioner, you never stop learning. Make sure you keep moving forward. Everything's changing constantly, like research, skills. We're learning new things every day.
This has been the most challenging speciality I've ever worked in.
There we go.
I thought I would get bored.
And you're a businesswoman.
I thought I'd get bored, but it has challenged me and continues to challenge me, and that fires me. Fires me up.
Yeah, I love it. So don't stop learning.
Don't stop learning. Again, we get back to the safety thing. Look at the experience of the provider that you're going to, the clinic you're going to, the clinic you're going to. What products do they use? What before and afters. I'm not big on social media, because I think sometimes it leads to different expectations.
And I think I don't even think it's that as well. What age group and stuff different clinics treat. Mm-hmm. So I know I've briefly touched on it before, but my main patient age group is late 40s, 50s, right up to 85, 90.
The same demographic as me.
They haven't got much confidence at first, and they don't want the before and afters on.
No.
So I used to post before and afters constantly.
Yeah.
And now instead we do stupid dances.
I know. We do all that sort of stuff, and photos of feet alongside with the guys here, don't we?
Exactly, and that's fine. I have got a question.
No, you just detracted from. I was going to say something, and you just detracted from that now. Oh,
dancing?
No, it was a really good point.
What were we on about?
Go on, I don't know. Carry on with something else and then I'll interrupt you.
Which bit?
I don't know. You were going to say you got a question.
No, I'm on about honest questions.
Right, okay. I was just thinking of something. Oh, that's it.
Oh,
you're the top tip. Top tip for listeners. Look at your practitioner's face. If you've got a practitioner...
I'm a bit frozen though right now.
No, you're not. You're not. If you've got a practitioner who's got cheeks up here, lips out here, skin is shot, or brows hoiked up, then if you're looking at them and thinking, I do not want to look like that, head for the door, because there is a match, there is an alignment with how your practitioner looks and what their ethos is, what they're seeing, what they're wanting to achieve and to undertake for you. Then just bear that in mind, because if they look like a freak or they look completely unnatural, maybe it's not the right place for you.
Yeah.
That's it.
You've just put something in my head as well, and I can't go into too much detail because I don't actually know the detail. But I just need to mention it. I did some training, and what they were saying is when you've been staring at something and it's such a short space of time, something like a minute or a minute and a half. So if anyone's listening and they know, put it in comments, and that becomes the norm. So if someone's got, which is why if someone's got huge lips and they're staring at them all the time, that becomes a norm.
Sure.
So they're reflecting that onto patients because that's their norm.
Yeah.
And also in general, if you've got huge lips and you're looking in a mirror, for instance, they don't, you become that filler blindness as well, don't you? Anyway,
that's interesting. That
it is, because we'll come to
everybody normalizes their field. Okay, listeners chat.
We mentioned on one of the podcasts that, I think it was on episode 1 or 2, that we don't do much lip filler anymore. And why do you think that is? There's a few things.
There are a few things on that. It's down to that patient for number one. So our demographic, my demographic, is similar to yours. So it's 35, 40, right the way up to 75. I've got an 80-year-old patient that comes in who is just gorgeous, and looks totally natural. But we have to look at the whole canvas of the face. So this is where our clinics and many of the people that we choose to mix with, professionals, that we're looking at the full face approach. Now, that doesn't mean full face does not equate to pillow face. Full face is looking at,
which is important,
the different zones of the face, because we need to keep harmony.
I love that word.
Harmony is, and harmonization is the buzzword.
It's nice. It's a nice soft word.
It is a really lovely word in how you look at it when it's written, how you enunciate,
and you do the fingers too,
and do the fingers. So it's, it's that smooth zen, and that's about transition from the upper face to the mid face to the lower face. So we're talking about everything needs to be on the same page. So for some patients, just doing the lips is a good thing, and it may look really good, but you have to take into account the different proportions of the face. It's an equation to look right. We have to look at the side profile, at the lateral profile as well. We are looking at all dimensions, and that is in the hands of a very experienced practitioner to say yes or no. For us, the lips will probably, for most of our demographic, be at the end of the journey. And most of our patients will go, no, you're not touching my lips. You're not doing that. You're not doing that.
The lips are the decoration.
No, they are the decoration. They're the cherry on the cake. And so there is no point in doing somebody's lips if they've got massive lines around this upper lip area, which most women of a certain age will have. Doesn't mean they're smokers. They're called smokers' lines.
And then the lips stand out more.
They will stand out because they are absolutely capsizing the boat. So you just see the lips, and then everything else is magnified in that it may need some sort of support or some treatment to the skin or whatever. It's not telling the same story. So for us, lips are a very, very small part of our business. We do have younger clients, but we are not about over projection. We're not about a standard template. I can look on people's, injectors, Instagrams or on their website, and I know exactly what level that practitioner is going to be. Because they're over enhanced, they've thrown the whole balance of the lower face. Russian lips, don't get me on that. Thank God they're blooming going by the by. But that's why
by the by.
Yeah, I know, as Bob Mortimer says, away and away. But we're looking at the full picture, and if we need to do other areas of that picture, we'll talk about that first, so if appropriate, so that everything just matches. There's fluidity.
I also think it's because the focus in social media trends have shifted from big lips. So you'll still have these practitioners who are just doing Russian lip. I've never done a Russian lip. But before I went into aesthetics, my lips were huge because I have no lips, and I was obsessed with The Only Way is Essex. So I was a shade of orange with big rubber lips which didn't move, and I look back and I think, what the hell? Which is why I never overfill lips now, and I'll just say no, because I was the mistake.
Yeah.
And now you see influencers dissolving the lips and more natural. So we're seeing less makeup, skin is always in, more natural features. And I never follow trends in practice.
No.
But we're seeing that
we don't
natural
even know.
is more of a
we don't even know what's trending half the time, do we?
I know that's one of the questions, and we're both like, what is trending? I think slugging and snailing were years back.
Is that like dogging?
God, oh my God, Rosey! Well, we know what you're doing this about time now, don't we?
But going on there, going with the Russian lips, just a technical hint here, or a technical information. When injectors are injecting Russian lips, they are going sort of perpendicular, aren't they, to the lips, and then they're withdrawing and depositing the filler. Now, what they're doing,
and it looks so traumatizing.
It's creating an upward channel because the needle is depositing the filler, squirting it out here, following that line. It's created from its point an upward channel of the filler to actually migrate more so into around the lip line. So please do not have Russian lips. There's more than just the look.
And you'll see all this bruising underneath.
High risk as well.
Because of the wrist. So they're just tapping that little artery.
Multiple, and the artery will get pretty naffed off with it.
Yeah, and then anyway.
Yes, there we go. So that's why we don't just do
See if I've got another question, which I feel like if you have like too much filler, what can happen? So as in like a really overfilled face.
You've got more risk of...
So like Bobby, for instance, I'm guessing. So, which he has openly admitted he had an addiction. Anyway,
that's psychological, isn't it?
Yeah,
that's a psychological.
So what can happen, as in if you have too much filler in your face?
Well, the obvious thing is how you look. That, I mean, you can be over enhanced. You can look very strange, to say the least. You've got high risk of migration of the filler, depending on the depths, amounts, volumes that have been injected.
Puffiness, water retention.
The puffiness will increase. It can affect lymphatics, which is the drainage to all of the body, but significantly to the face that we're talking about. Even if the jawline is injected incorrectly, you can actually have the effect of affecting the lymphatics up around the eyes. Huge risk of, are these different fillers that have been injected? Are they the same filler that's been injected? Well, how is that filler going to break down? Is it going to break down evenly? Is there a risk of granulomas that can happen where it clusters and creates lumps in the face further down the road?
And filler doesn't just last 9 to 12 months anyway.
It doesn't last.
It's been shown on scans 10 years later. You can still have little bits.
And if it's sitting in the right place and doing what you want it to do, that is a great investment.
Yeah.
And somebody has done that treatment really well. But if you overdo it and it starts to move, it doesn't get legs. The filler doesn't walk around the face, it would just move into the neighboring slightly area, but that's down to the hands and it's down to the volume of the product and the depth of it, but that comes down to the injector. So it's there is a really strong voice in aesthetics that the best clinics will say no. The best clinics will say no if it's not something that is going to meet what you're requesting it to do. Is it appropriate for you? Obviously, if your health is is aligned to that as well. So the best practitioner will say no if it's something that they can't deliver. You've got unrealistic expectations. You just don't need it.
No.
Because maybe there's something else that is going to be better for you, or nothing at all.
Yeah.
That's the take home, isn't it?
That's the take home.
You've got the choice in that treatment room on that day You choose what you want to do, not because of what anybody else is giving you the information for. If you feel safe, if you feel protected, if you feel comfortable,
do it for you.
Do it for you.
Do it for you. And while we're wrapping up, we do love filler. It'll always hold a place in his clinics and in his hearts.
It'll always be in my heart.
Don't ever be scared. Just do your research on your practitioner. And as a practitioner, do your research on your products and who you're working with and the companies and stuff. So
exactly. And build that experience slowly.
And that's it. Thank you for listening. If you're still with us.
The single listener, the song listeners.
Thank you for the one of you.